Hi, everyone. Thanks so much for joining us this evening. I am so excited to have Dr. Stellrecht here to talk about the clinical year. So thank you so much for joining us this evening. We do have a question section, so please do feel free to be interactive and enter your questions in the section that you see there so that we can answer them as we go. Also, you're going to notice a URL pinned at the top of your Facebook or YouTube comments section. So feel free to click on that as well to learn more about Ross Vet. I'm going to pass it over to Dr. Stellrecht to introduce herself.
Hi there. I'm Dr. Stellrecht. I was a Rossi. I was in blue semester. I left in April of 2019. I went to University of Minnesota for my clinical year. And then I finished up there this past May, and I started a job here in Minnesota as a small animal veterinarian in June, and I've been working there ever since. And these are my kitties behind me. They're actually from the island. I brought them back with me.
Oh, wonderful. That's awesome. Can you tell us a little bit about the clinical year and what that looked like for you in terms of the process and how it worked?
Yeah, so kind of starting clinical year and thinking about it and what to choose and where to go. Those are all a lot of big things that everybody's thinking about as a 6th and 7th semester down there. A lot of things revolve around what you want to do as a veterinarian. Do you want to be a large animal veterinarian, small, exotics, dependent on what type of exotic too, just because you can't do a whole lot of tortoises and dolphins and that type of stuff here in the middle of the US and Minnesota. So that's one thing to look into, first of all, is just to see what place is going to give you the best out of the most out of what you want to do. For me, it was mainly small animal caseload that was my interest, just because Minnesota does see a very high volume in that. If you're looking to be an equine vet, Minnesota is probably not your place. You can be one here, but if you're really looking to get the most out of it, 6 months of Minnesota is snow, so a lot of people aren't working with their horses too much during that time. So being in a place that's warm year-round is probably best for something like that. Other things to think about are locations, where you want to be. If you're used to living in tropical climates your whole life, Minnesota's a little bit of a shock if you want to do something like that. It's always something to think about as well. Another big factor was family for me. I really enjoy being with my family and spending time with them, and being on the island for 3 years away was hard. So they're back here in Minnesota, and it's been nice to spend a lot of time with them for the past year or so.
Wonderful. That's great. And so how did you sort of go through the evaluation process? You wanted to be close to home. Maybe talk us through, you probably had a lot of friends that were looking through different options and what that looked like. And do you feel like there's enough time in your preclinical semesters to actually evaluate all of the options and learn about those schools and the clinical placements that are available?
I definitely think if you're proactive, there's definitely enough time to figure out where you want to go, collect all that information, and kind of weigh your options. I know a lot of the schools have representatives that will come down and speak about their clinical year. I actually tried to do that, but COVID happened, so here we are. So there's a lot of these different things that we can go through and watch, and you can kind of pick the pros and cons out of that. Meeting with your clinical year advisor, you can do that even before 6th and 7th. If you're interested in 5th and you really want to get a jump on it, you can definitely do that too. So there's plenty of time to figure out where you want to go. I didn't feel rushed at all, but then again, I was pretty set on Minnesota. So but I did weigh all my other options as well, just in case my dreams were crushed on clinical placement.
That's awesome. Great. I do get a lot of questions from students who ask about that interview process, with the clinical advisor and what that looks like. So that's great to know that it can be done prior to 6th as well. So thanks for letting me know that. And then what about the clinical placement ceremony? Can you kind of walk us through what that looks like? It's a really exciting time. We've seen live streams of it throughout the time, and some of us have been present for it as well, and that's exciting. So tell us about that.
Yeah, it's a super exciting night for everybody. You know, a lot of family, I mean, not now, but you know, a lot of family was able to come. A lot of your friends could fly down because it's a really special night for everybody. And you know, everybody gets dressed up and you go sit at your little place and you have your little, I think it's like a non-alcoholic champagne, and you have your letter in front of you, and you listen to the clinical advisor talk, the dean, I think one of the students talks as well. So it's a little ceremony, and then everyone opens up their letters at once, and it's a surprise. So for the Minnesota students, I will say that you do have a little bit of a upper hand in knowing if you're going there right away, just because of the behavioral interview that comes along with going to Minnesota. But most of the other schools, it's a surprise. So.
Oh, interesting. Can you expand on that? What do you mean?
Oh, for like the interview, or for
the behavioral interview. What does that look like?
So Minnesota, they have it's kind of like a what would you do in this situation interview. I think a lot of jobs do this type of stuff when they interview you. But Minnesota just kind of gets to know you and kind of throws out scenarios here and there and how you would respond to it. I think it's one of the only schools, if not the only, that does that interview. And I'm not sure why, but I didn't think it was too bad. I think it's just kind of getting to know your character and how well you'll sit with Minnesota. So
interesting.
I'm pretty sure that most people get in or haven't been too denied by it. All of my friends that I know wanted to come here were able to pass it and come in. So it's not anything to be like scared or nervous about, or, you know, thinking that everyone gets denied from it. So it's pretty easy.
And are there, I get this question a lot as well, are there GPA requirements that are specific to each school when trying to go there for a clinical year?
Yes, there is. I would definitely say that those have a little bit of a limitation on them. You kind of got to know where, like if something says 3.0, and you got to kind of know where your competitors are at. If everyone's at like a 3.8 and 3.9 and 4.0, and you're kind of in the 3.0 area, that's another good thing to sit down with your you know, with your clinical advisor and just have a real chat about, you know, what's a good spot for you and what your chances are, so you're not, you know, end up left with your fourth choice on clinical placement night. So I do recommend I think everybody has an interview with the clinical placement advisor, but it's definitely a good thing to talk about and touch base. And you know, if you aren't sure what's the best place for you, you're kind of up in the air, having them kind of put some options on the table for you is always a good start as well, to start researching there.
Okay, wonderful. And that's a great transition piece. So just to quickly summarize what that looks like, you're going through your preclinical 7 semesters. In your 6th semester, you're going to interview with your clinical advisor about the school that you want to choose. 7th semester, about the first week, you're submitting your top 4 choices. Is that right?
Yeah.
And then by 3rd week of 7th semester, you have your placement ceremony and you find out where you're going. And then you mentioned the interview that takes place with the school as well. And when does that happen in the timeline?
I want to say, sorry, I'm trying to reach back now. I want to say it's end of 6th semester, I think, is kind of when you put the ones that you want in, and then the end of your 6th semester GPA is what's going to determine, you know, what school you can go to. So you can kind of have lined up where you want to go, and if there's any, you know, major changes at the end of the 6th semester, then you might have to make. That's why they have the first week of 7th where you can make changes. But just got to keep your grades, keep them up, and then you wouldn't have a problem.
Fantastic. That's great. So thank you so much for that. Can you tell me about a typical day while you're in clinical year? What does that look like in the rotations?
Yeah, so for those 7 semesters that are soaping or have soap, or kind of leading into that, it's kind of like that. So you show up, you kind of get set for the day, look at your cases. The first day of all rotations is going to be like an opening day orientation, kind of going over how everything's going to go. But then usually the second day is when you come in, you get all settled in, see what your patients are going to need, what's required of you for the day. Then you go assess all of your patients. Usually you're only going to have, one or two hospitalized patients. They don't throw a huge load on you as a student. It's just dependent on the rotation as well. I think on large animal rotations, I had a couple more patients than I did to assess during my small animal rotations. But you'll do your soap just like you do, your exam, your soap, and then kind of make a treatment sheet for the day. I don't think that was a thing that we really did with our donkeys and sheep at Ross, but having a treatment sheet made for hospitalized animals is a pretty standard thing that they use throughout the hospitals.
How long are the days as well?
Sorry, what was that?
How long are the days? I get to ask this all the time. Is there time to do anything outside of?
Clinical year is pretty strict, especially if you're putting your whole heart into this. If you're trying to get the most out of your clinical year, there isn't a whole lot of time for. You can have a life, but there's just a lot of paperwork that comes along with clinical year. And on your core rotations, especially like small animal medicine, large animal medicine, small animal surgery, large animal surgery, all of those, it's looking like a 12+ hour day. So, and that's not just speaking for Minnesota. I have colleagues that, we have our little group chats from the island still, and they were doing 12 to 14 hour days too. And they get long, it's tiring and it's stressful, but it's really worth it in the end, because those days that, you're really learning and you're really absorbing a lot, going through rounds and, evaluating your patients. So.
Wonderful. We do have a question from the audience. Thanks so much for engaging. What was your favorite rotation?
Oh, my favorite rotation. I don't think I've been asked this before.
On the spot.
I really liked, I think my favorite one was probably dermatology, just because I have a German Shepherd and he's a walking dermatology case. So he was really fun. I was able to bring him with me to the rotation a couple times, and we were able to do, skin scrapes and tape preps, ear cytology, kind of go over his history. And he was used as a teaching case on the days where things were a little bit slower, which isn't often in clinical year.
Good. And then another question from the audience as well. What was the toughest thing about your clinical year?
I'll have to say getting sleep.
Okay.
I was very.
Did you eat too?
Yeah, that's, you can get your snacks in throughout the day. I'm not a big, huge 3-meal person, so just snacking all day is kind of my norm at this point. But I think the toughest thing was just really trying to learn the work-life balance. At Ross, I think some students probably had it figured out. I didn't. I like to be on the beach and, doing all the fundraisers and all the fun stuff that comes along with the island and Ross. And I definitely had a good balance while I was there. And then clinical year was a little bit of a slap in the face, and I was like, oh, I need to learn to balance this a little bit better between paperwork and kind of working harder during the day instead of getting frustrated with trying to look things up and what does this mean, before you go present it to your professor, your clinicians and things like that. But I think I got there, and then definitely out in the real world, it's something that you do have to work on. Like if you're in a high volume practice, or especially right now, I think it's throughout the whole country. It's pretty, everyone's pretty overwhelmed right now in the veterinary field. So definitely something that was very hard for me to accept, and just continuing. But you find your balances, and you have your friends and your family to be there for you when you're having a rough day.
Perfect. I was going to actually ask you next. You mentioned friends and family, but any other coping mechanisms that you use to help balance throughout clinical year? And when you mentioned that work-life balance, and you had it at Ross, and you had the beach, yeah, beautiful, great example.
Having these guys to come home to every day has been awesome. If I don't know how anybody in veterinary medicine doesn't have a pet. I mean,
Yeah,
it's I take my dog for a walk. These two make a constant mess all the time. I'm cleaning up after them. So having them to be here every day is pretty awesome. But
it's a great stress release.
other than that, I think it was just finding little hobbies that you like to do outside of just normal stuff, napping and, having your favorite snacks and stuff to try and relieve some stress. But during quarantine, actually, when I had a few weeks there where I was stuck in my house, puzzles and Sudoku and all that kind of stuff that I normally wouldn't do, I got into, and sometimes I'll just remove myself from whatever I'm doing, paperwork and stuff, and just work on a puzzle for a little bit because it just switches my brain to a different thing and it helps, I feel like.
Okay. I have a question as well. How well prepared did you feel when you entered your clinical year? So we get that question all the time. How prepared are Ross students when they go into clinical year? How'd you feel about that?
Yeah, so the aspect of like just knowing kind of how the day goes and what's expected of me was a little bit of a rough start for me because I guess, you have your outlines and your syllabus and all that type of stuff. And then you have your other Rossies to lean on most of the time if you have a few to go with. But that was where I felt a little unprepared, I guess, was just kind of knowing the flow of clinical year and what was expected of me. That's a lot of the reason why I like to do this, just so I can kind of give everybody a little bit of insight into clinical year. Because if you don't know anybody that's in an upper semester or anyone to like lean on and talk to, it's kind of hard to know what's expected. That can be kind of scary sometimes.
Mhm.
But I definitely think Ross did prepare us in the educational part. Maybe sometimes during rounds, the Minnesota students were a little bit quicker to answer things than me. But I definitely feel when it came to performing any type of surgical skill or kind of hands-on stuff, I felt that I was the student that was chosen to either do it or I jumped in first because I knew how to do it. So I definitely feel Rossies have the upper hand in that section. And I've heard that from all of my friends as well, that they definitely felt more prepared in the hands-on aspect of their fourth year.
Interesting. I'm going to take it back a notch just to, your upper semesters at Ross. You mentioned that you had some time to, be on the beach. And did you take part in any clubs? And do you feel like that, I want to say, customization of experience and taking additional experiences from the clubs, did that help you at all? Or did that add anything great to the experience of clinical year?
Yeah, so I've always been super involved in doing stuff outside of just classes and learning. So I definitely was involved a lot at Ross, mainly with PAWS. I was the medical coordinator. I felt that not only kind of helped me build, with all the shelter animals, you get the experience with that, but just interacting with the locals and kind of having almost a client interaction because a lot of the locals and down on the island didn't know what spaying was and that you could take that ability away from them so that these locals didn't end up with 30 puppies every year. So getting those questions out in the field like that I thought that was a good learning experience for me at least, because you never know the type of questions you're going to get hit with in an exam room. Let me tell you, there's some wild ones.
I can imagine.
So I felt that being in those clubs down at Ross and being able to interact with the locals and, just other people is a good experience that way. And I definitely feel that the clubs helped me get just hands-on experience, not only for clinical year, but for or just out in the field now. So I definitely think if you can handle your school load and joining a couple clubs on the side, I definitely think that will benefit you through your clinical year and out in the veterinary field.
Excellent, thanks. We have another question from the audience. How did you get over any nervousness as you started working with patients early on in clinicals?
Yeah, so that's a big one. That's a huge one for everybody, and I see it like I saw it so much secondhand just because you can go in with other students if there's, especially in dermatology and that type of stuff, you don't get a lot of the same cases. There's a lot of different stuff. So, 3 students will go in and kind of learn from one patient, and one student will kind of handle the history and the physical and that type of stuff, and you can just hear the shakiness sometimes when they're doing all that. And everyone's like that at first. It's like that with everything you do in life, whether it's a speech like this or anything new, but you just do it every day, and eventually you start finding out, oh, I was right about that. Oh, I was right, and it's that little sign that you get that boosts the confidence. So you definitely get a lot of that during your clinical year with dealing with patients and their owners and all of that. So it's just practice. I was a technician for 3 years before I went to vet school. So a lot of that was easier for me, and I was able to go in and handle stuff like that a lot easier than other students right away. But don't get me wrong, I was still very nervous at first. And even to this day, I'll walk into an exam room and be a little bit nervous if the presenting complaint is something I haven't dealt with before. So it's normal to be nervous, but you just got to trust yourself that you'll know what you're doing and you'll get through it.
Wonderful. Do you still reach out to Rossies that you've gone to school with and worked with, and what does that look like afterwards? We always hear about the Rossi family, and that becomes kind of, you gel together on island, and then what does that look like during clinicals and after?
Yeah, so I think that the Rossies that I met are my lifelong friends. They're my best friends. I can lean on them for everything. I had a couple different friend groups while I was down there, and I still talk to them every single day. We have a group iMessage chat, and then we have a group Snapchat as well. And we bounce cases off of each other. We send weird cases. We send cool pictures, or look at the 12 puppies I examined today. It's keep each other afloat, I feel like. And I really think that's great to have that little support system. Yes. Oh, look at there they are.
Yeah.
22 Great Dane puppies.
You want to name them all for us? I'm just joking. What was your favorite or most interesting case, would you say, during clinical year?
I had the one that stood out the most to me was I think his name was Buddy, and he presented for being, everything on him was yellow. His ears, his eyes, his mucous membranes, everything was yellow. So, obviously first thing comes to mind is there's something wrong with the liver. And there was, every liver value was through the roof. And he was started on a bunch of supportive care and hospitalized with us in order to just kind of figure out what was going on. And the owners were a little bit sensitive with cost and things. So just trying to work through cases like that was a good learning experience. Just trying to do things without throwing every diagnostic and every treatment at it. But it turned out that they eventually went to surgery, and he had a gallstone that was kind of going in and out of his gallbladder and causing him, and the last time it happened, it got stuck, and that's what increased his liver values. So that was pretty cool to go into that surgery and just kind of see the whole thing play through. If you don't if you don't go out into the veterinary field as having all those diagnostics and having the surgeons there, you don't really see kind of the outcome of the patients. The things you refer for, you don't always see the surgeries and that type of stuff. So it was really cool to kind of take in that patient, follow him for a week, and then finally get to the end goal here and take that out and treat him. So I think that's the case that stood out the most, and I think was the most exhausting, because it was just every day it was like, oh, it's going to get better. And it finally did. So it was a good ending.
Sounds very rewarding. Thanks for sharing that. Can you talk to us a little bit about the difference between internships and externships? How do students get involved, and did you take part in any?
Yeah, so externships and internships are different. A lot of people use them interchangeably, and they are separate things. So externships are something that you will do during your um, clinical year as like depending on how long your rotations are, whether they're 2 weeks, 3 weeks, or 4 weeks. But usually an externship is something you go find on your own in some place that you're interested in. Like for me, I went to the clinic that I was a technician at and did an externship there. Just because I knew everybody and I was in a comfortable position, and they were comfortable with me. So I was allowed to do a lot more things like hands-on during surgery and stuff. But it can be used as other things if you don't, let's say I didn't get ophthalmology during my clinical year and I really, really wanted that. You can use your externship as you can go do that at a different ophthalmologist outside of the university. I think you can also do your externships at other universities too. So if you're dying to see your boyfriend or your best friend or your girlfriend, doing externships at their university is an option too. They just, there's more paperwork for that. But that's externships. I think I was allowed anywhere from 2 to 5. So it just depends on, where you end up. And there's something that you find on your own. You have to do the footwork for it. You have to do the calling and setting it up. And then you give it to the school and they approve it. Okay. And then internships are something that you do after your clinical year. And that's kind of the main one everybody thinks about is the academic internship. So once you get into your clinical year, you'll notice that you're working with interns, residents, and then there's the faculty or the clinicians that are kind of like the top. Everybody goes to them. So an internship is something that you apply through the match program for. Usually you can do it outside of that if you want. But you apply through there and then you kind of pick your top 3, I think it is 3 or 4. And then if you get accepted, then you will start that after your clinical year, and you'll kind of, you're just a step above a student, but you're not quite, you are a doctor at that point. So you're making doctor decisions, but you have the luxury of sitting down with residents that have 2 or 3 more years of experience with you, and then learning from the clinicians as well. And then usually if you're in an academic setting, you're getting all of those rotations through, you rotate through ERs, SAM, LAM, all those. If you're mixed, it depends on which route you go. But yeah, so internships are great, but you're still getting those long days still if you're doing an academic internship. You're there just as long as the students, if not longer sometimes, because you are a doctor at that point. So more is expected of you than as a student. So internships are a lot to think about. I didn't do one just because I wanted a little bit more work-life balance. And I'm now seeing that I'm still kind of getting, the place I'm working at is a very high volume place. So I'm getting kind of what I didn't want, but it's fine. It's okay.
Awesome. Good. And then can you tell us a little bit about different species that you've worked with both in and out of clinics?
Yeah.
You mentioned you were a tech for 3 years, so I wanted to kind of go back to that, and you've probably seen a lot. So tell us about that.
Yeah. So when I was a tech, I just worked at small animal vet clinics, and mainly small animal stuff. We saw a few small furry pocket pets. And I didn't really do a lot of diagnostics with them just because I wasn't trained to work with them at that point. But then when I was at Ross, obviously you work with all the barn animals. I was in the pig club, so I got to go out and vaccinate some pigs and get a little bit experience in that field. Now that, during clinical year, it was only small animal really, because that was my focus. And then I did a couple large animal rotations because as a Minnesota student, coming from Ross, you have to be mixed. doing a mixed animal rotation type year. So now I'm doing, there's a whole lot of animals I see. Basically anything that will fit through our doors, we will see it. And a lot of the times I kind of just watch the exotics doctors and kind of learn about how to draw blood from different places. Because, I mean, when a snake comes in and needs a blood draw, you're just like, you panic at first because you're not used to a jugular vein or a cephalic vein. So even just learning how to handle these things and hold them and restrain them for that type of stuff is a really good learning experience. And that's not even the medicine part of it, which exotic medicine is an art, let me tell you.
Yeah, definitely. That's amazing. Do you want to tell us about what we're seeing here on the screen and what we're looking at?
Yeah, this snake actually, I think it came from Petco. We see there's one right next door to us, so we actually work with them quite a bit. And they'll send over their sick animals and stuff and just kind of approve what we can and can't do. And this is the snake that I actually drew blood on, and their heart beat. You draw it from the heart, and it just was. It was a difficult thing to do. I actually ended up getting the blood, and the exotics doctor couldn't before me, so I was bad advice.
Yeah,
for that one, but I had guidance in getting
a field day with that.
Yeah. But she handled the medicine side of it. Just it was more of a. I'm still kind of in the phase of kind of learning how to handle exotics and restraining them, and if they present for this, what do we do?
Okay, fantastic. Thanks. Okay, so another thing that's taking place during clinical year is the Napoli exam. So can you talk to us about that piece? You mentioned already being short on hours, and how did that look for the balance and preparing for that exam throughout clinical year as well?
So I started studying within 6 months of when my NAVLE was going to take place. So it's something you kind of got to start thinking about depending on, where you're at in your clinical year, since NAVLE takes place in November, kind of November, December, and then the April, May. So it all just kind of depends whether you want, kind of a 3-month study plan or a 6-month study plan. And all the Rossies get the vet prep course for free. I recommend it. It might not work for everybody, but I definitely feel it helped me because I need something that has structure, that tells me what to do every day. Otherwise, I kind of fall off if I don't have like a calendar or something. So vet prep was really good for me to use, and I used the 6-month one, and I stuck to it pretty religiously. And I think that's a lot of the reason why the first part of my clinical year there, I didn't have a lot of a life outside of clinical year, because I was making sure that I got that time in every day to study for the NAVLE, even if it's just reading a power page on hyperthyroidism in a cat, and then doing, a 20-question quiz or whatever after that. Even if that was it, I needed to do something every day just to keep everything flowing. And a lot of the times I'd find some things in vet prep that correlated to what I was actually working with. So it was nice to go through that and apply it to clinical year. And it was actually pretty cool. Like, oh, this isn't worthless. Like, I'm going to use this.
Yes,
But
definitely. I'm being asked, what is the NAVLE exam? Could you give us a little bit more information on what it is, when it takes place?
Yeah. So
for those who don't know,
it's like a 6-part test, and it's 1 day long, and it's about 6 to 7 hours of your day. And it takes place either in November or December. The testing window is that time, or there's a April to May testing time as well. And there are 6 sections. I think there's 60 questions each, and you have an hour for each of them, if I remember correctly. Sorry, it was a while ago. But it's timed, so you can, it's possible to run out of time for your questions and stuff. So I recommend taking the practice test before that NAVLE offers. They have 4 different ones I think you can take. They cost $50 each to take them. I did two. I did one 2 months before my NAVLE date, and then I did another one 1 month before my NAVLE date. And I think it really kind of helps you see where you're at. You kind of just get like just a score. It's not anything that they record or anything like that, but it just kind of like helps you say, oh, I really need to step up my game and where I'm at in studying, or, oh, I got a lower score than last time. Maybe I slacked off on studying this last month. But I definitely think taking practice tests, those timed ones at least, puts you in a good spot to know where you need to be in a month or so, or whenever you choose to take them.
And so this is the North American Veterinary Licensing Exam. Just to clarify for those who don't know, and it takes place whichever vet school you're coming from in North America. It's not an additional step that's required at Ross. It's just for everyone that wants to become a vet. So I think that's it. Do you have any other cool stories for the clinical year? Otherwise, we can go into kind of your current role, and if you can tell us a little bit about what you're doing now that piece is done for you.
Yeah, so like I said, I started in June at where I work now. It's a small animal and exotic veterinary clinic. We do see, I guess, large animals, you could call them as well. If a pig comes through the door or a goat comes through the door, pretty much, like I said, anything that fits through the door, we will see it.
Can you tell us more about the goat?
About the
I'm like,
goat?
wait,
Yeah.
what did I just hear? Tell us more.
This wasn't the exact goat, but this is one of the girls I work with. She's a technician and she breeds goats. But there was one day one of her friends came in and brought her goat, and he was having trouble urinating. So we all kind of thought, oh, goats get the buildup of the stones sometimes. That's where all of our heads were kind of going. And they were trying, one of the technicians had the goat up on the table, like, kind of like a dog, and was trying to like lift it up, and the goat was just not having it. And I was like, let me hold the goat here. So I put, it was a 5-month-old goat, so it was fairly small enough. So I put him on the ground and I flipped him like we do our sheep at Ross, and he just laid there. And sure enough, they had banded him, which none of us knew that he was banded around his scrotum, and it was kind of falling off and infected and pretty bad looking. And here we all are looking at his, trying to see if there's stones building up outside the hair and stuff. And it was just pretty cool because none of the other doctors knew how to restrain a goat like that. The technicians didn't know how to restrain a goat like that. So it just made the whole process a lot smoother. And we were able to immediately see what was happening instead of like look at there and everything. So, it was a little hair flip moment for me because I was like, we're Rossies.
Yeah. Awesome. I love it. Thanks so much. Okay, sorry, I hope I didn't interrupt, but I think you were telling us more about what you're currently doing, and what does a day look like now?
Yeah, so a day now, my schedule's pretty all over the place. I'll have some 7 to 4 shifts. I like to do urgent care shifts, so I do 2 to midnight shifts. I'll have on-call shifts a couple times a week, so that's where if people call the clinic in the middle of the night, I have to wake up and answer it. Or if the girls at the clinic need me, the techs need me for something, I'm available for them for that. And then I have a couple really long days. I'll work a 13-hour shift once every 2 weeks. I actually just did that yesterday. So I'm doing hospitalized patients and kind of taking care of phone calls and everything from 7 to 9 in the morning. And then we start seeing patients at 9 till the end of the day. There's a lunch break and some catch-up time sprinkled in there. A lot of the times I use it for my paperwork and my phone calls. It's pretty rare that I actually just remove myself from the clinic for lunch, but I choose to do that because I'd rather take my time to get my paperwork done and my phone calls rather than staying late and taking my lunch. So it's kind of all dependent on, and some doctors they'll leave for lunch for an hour, or other doctors will watch a show for an hour, and it's just dependent on what you want and kind of how you want your day and your balance to go. Yeah, I see half an hour appointments now. At first, I was seeing 45 minutes appointments just to kind of get through the flow of everything. But I will see anything from a new puppy exam to a really sick internal medicine case. We have the ability to do abdominal ultrasounds, CTs. We have board certified surgeons come in all the time and do our surgeries, board certified ultrasonographers, cardiologists. So we do a lot at my clinic, and it's really cool to follow through my cases and just kind of be able to see what comes out, like what my results are. And I really like that. Internal medicine, small animal internal medicine was probably my most difficult rotation in clinical year. I struggled with that one the most because it's hard. It's learning the inside of an animal is not an easy thing. But I've become a lot more confident with it. And I see those cases every single day, even though I'm a primary care doctor. So yeah, that's kind of my day.
Love it. It's so fascinating. Thank you so much. So before we wrap up here, I just wanted to kind of see if you had any parting words, advice to those students, prospect students who are looking to start their journey to vet med. Any recommendations before applying? Any tips that you can share?
Yeah, so I think a lot of it is keep your head up. Don't give up. Just because I know that applying, getting into vet school and applying sometimes isn't always as rewarding as you think it is. I will say I was denied my first 2 years from the University of Minnesota before I got into Ross. And it was pretty hard to hear those at first, but I just kept building my, getting that experience, research, and that's my application was lacking, and just really knowing like what you need to work on in order to get into vet school. And that's kind of just been my whole outlook through Ross, through clinical year, and even now as a veterinarian. Days are hard, and sometimes you feel like you're like, should I be doing this? Like, this is super stressful. Was I meant for this? And I promise, every time you ask yourself that, you're meant for this. You're going to be able to do it. Just if you put your mind to it, you'll get there. But it does take hard work, and getting into vet med, staying in vet med, and continuing as a doctor in vet med is not an easy thing. So I applaud everybody that is a veterinarian because it's hard.
I got tingles all over. Thank you for that. Thank you so much for taking the time today to speak with us. I know we took up your evening, and you already have probably a very tight schedule, so I appreciate it so much. I hope you're staying safe during this time, and everyone out there watching us today, thank you so much for joining us. Don't forget to click on the URL on the top right of your screen if it's YouTube and Facebook that you're watching. Learn more about Ross Vet. Thank you so much, Dr. Stellrecht, and everyone for joining us this evening.
Bye, guys.
Bye.